If you are between day 3 and day 5 postpartum, you may be experiencing breasts that are swollen, hot, and painful. This is milk stasis, a condition where the breasts become overly full and hard to the touch. This simulation illustrates the internal mechanics. When milk production increases rapidly under the influence of prolactin, but isn't emptied effectively, fluid accumulates in the milk ducts. This buildup creates the physical pressure and hard lumps you feel. We will now walk through a 5-minute protocol to help initiate drainage. By combining Western medical physical treatments with traditional Chinese medicine's energetic techniques, we can address both the blockage and the systemic stress that often complicates it. To begin, gather a warm compress, a cold pack, and find a quiet, comfortable chair. Having these ready will allow you to move through the steps without interruption. An integrated approach is necessary because engorgement involves both a mechanical blockage and a physiological stress response. Treating the drainage while calming the nervous system helps restore the natural flow of milk more effectively than treating the breast in isolation. Step 1. Place your warm compress on the affected breast and take 3 deep, intentional breaths. In Western medicine, this warmth is used to physically dilate the milk ducts. As the pathways open, the milk can move more freely toward the nipple. From a TCM perspective, deep breathing addresses liver-qi stagnation. Stress after childbirth can cause an energetic obstruction physically felt as a clamping on the milk channels. Relaxing the mind helps release this grip. Calming the nervous system triggers the release of oxytocin, the hormone responsible for the milk letdown reflex. This step prepares both your mind and your body for the drainage to follow. Step 2 is acupressure. Use 2 fingers to apply a gentle circular motion to each of the following points for 30 seconds. First, locate CV17, or Shanzong, located in the center of the sternum. In TCM, this point is used to regulate chest qi and move milk flow. Next is ST18, or Rugen, found at the base of the breast. This is a primary point for opening the milk ducts and reducing local swelling. Finally, apply pressure to LV3 on the top of the foot and LI4 in the webbing of the hand. These distal points are used to move qi throughout the body and reduce the tension associated with engorgement. Stimulating these points works to clear the localized physical blockage while simultaneously addressing the systemic emotional stress that can hinder lactation. Step 3 is the active removal of milk. Begin by latching your baby or using a breast pump to start the drainage process. If you are breastfeeding, ensure the baby latches on to the entire areola rather than just the nipple. An improper latch makes milk removal inefficient, leading to residual milk and further stasis. While the milk is flowing, perform a gentle twina massage. Use your hands to sweep from the outer edge of the breast inward toward the nipple to assist the drainage. Avoid aggressive squeezing or forceful pressure. The breast tissue is already inflamed, and excessive force can cause trauma that increases swelling. Combining mechanically correct milk removal with gentle, directional massage helps evacuate the trapped milk while minimizing further inflammation. Step 4. Once you have finished feeding or pumping, apply a cold compress or a chilled towel to the breast for 10 to 15 minutes. While heat was used earlier to promote flow, the cold now constricts the blood vessels. This helps reduce the residual swelling and provides relief for the local pain. For continued management of pain and inflammation, medical professionals often suggest over-the-counter options like ibuprofen or paracetamol, which are compatible with breastfeeding. Remember the sequence. Apply heat before feeding to encourage the milk to flow, and use cold after feeding to manage the inflammatory response. Step 5 is monitoring for complications. While most cases of engorgement resolve with frequent emptying, you must watch for signs of infection. Seek medical attention if you notice any of these symptoms: a high fever, localized areas of intense redness, pus discharge, or if you feel exceptionally weak or dizzy. These are indicators that the stasis may have progressed to mastitis or a breast abscess. These conditions require a doctor's evaluation and may necessitate antibiotics. Identifying these symptoms early and seeking professional help is a necessary part of ensuring a safe and successful postpartum recovery. Now that you have completed the protocol, the breast should feel less heavy. While it will take time for the internal inflammation to fully subside, the immediate pressure of the trapped milk has been reduced. To prevent the stasis from returning, the most important step is regular emptying. Aim to feed or pump every 2 to 3 hours to keep the milk moving. Be mindful of common triggers, like sudden weaning or tight, restrictive clothing, which can compress the milk ducts and lead to new blockages. By combining mechanical drainage with energetic stress relief, you now have a set of techniques you can use to manage your milk flow and support a healthy lactation experience.